Very happy evening to
Hello.
all those who have come into the webinar of K.S.Varier's Ashtanga Ayurvedics Private Limited. We try to bring you varied topics every time, every month, with different doctors giving their different opinions, and so that we get a larger perspective of what we are trying to understand. So today it is Dr. Gowripriya who will be introduced by Dr. K.S.Varier later. I take this proud privilege to introduce my company, K.S.Varier's Ashtanga Ayurvedics Private Limited, where I work as the executive director. The company was started by my grandfather in 1936. His name was K.S.Varier. He was an Ayurvedian, studied in Kottakkal under the eminent P.S.Varier, Vaidyaratnam P.S.Varier, as he was known. So K.S.Varier studied there in the year, completed his course in 1933 and established his company in 1936 at Trichy. And since his starting the company from in 1936 in Trichy, the company has grown over time, and he has left a large legacy for us to follow. K.S.Varier was a doyen in his field. He had a lot of patients who came from different walks of life, different places. And he also treated animals, so to say. He had treated the temple elephant of Rockford Temple. So this was a rare case of a cancer being detected in the animal. And the doctors had said that the elephant will live only for about 2 months, wherein K.S.Varier started his medications, and the elephant lived for another 2.5 years and died of a different cause, not of cancer. So this was something we are very proud of. So such is the history of K.S.Varier and Ashtanga. And today we manufacture about 300 products. We use about 450 raw materials, all natural sources. We purchase raw materials from all over India, and we sell our products all over India in various places. We also export to a few places. And this is what the company is. Company is running to the 85th year now, and we are in to go on for more years. So I'm the third generation. I'm not a doctor. We have our amongst us the managing director of the company, K.S.Varier, and the medical superintendent, T.V.N.Varier, Dr. T.V.N.Varier, who has put in 50 years of practice in Ayurveda. He studied in Kottakkal, 1971 batch pass out, and he is also here with us. So with this short introduction of K.S.Varier's Ashtanga Ayurvedics, I hand over the session to Dr. K.S.Varier, who will do the rest of the session.
Thank you, sir. Am I audible?
Yes.
That is great. Okay, I had some technical issues, so now we are back to normal. So today's topic is based on health being the central part of human happiness and well-being. It is a balance of all the three fundamental states of being, such as the physical, mental, and spiritual, and the relationship with the outside world. Now, Ayurveda considers the health or swasthya as basic to the understanding of any disease or abnormality. Also, swasthya, to be established in oneself or one natural state, is optimal health according to it. So the topic today is Ayurvedic perspective of health. The guest speaker here is Dr. Gowripriya Ramachandran, B.A.M.S. MD.IU, consultant at Answer Ayurveda, Bangalore. There is a brief profile I would like to, I'm happy to introduce Dr. Gowripriya to all of us. I have been happy to have worked with her for a brief period of time. A brief profile of the guest is Dr. Gowripriya Ramachandran completed her undergraduate studies at SDM Ayurvedic Medical College, Hassan, and post-graduation in the area of Kaya Chikitsa, that is general medicine, from DGM Ayurvedic College, Gadag. Formerly, she served as medical officer in IIM, that is Institute of Ayurveda and Integrative Medicine, in Neurological and Musculo-Skeletal department. That's where I have worked with her. So Dr. Gowripriya currently serves as a consultant in Answer Healthcare Private Limited, Bangalore. She has over 13 years of clinical experience in managing various clinical conditions and has about 6 years of teaching experience guiding undergraduate Ayurveda students. So with that, I would like to ask Dr. Gowripriya to take over the stage. Before that, I would like to ask all participants here, if you have any queries, kindly put it in the chat box. We can answer the queries at the end of the session. Yes, Doctor, please take over the stage.
Yeah. Good evening to one and all. Am I audible? Yeah. Okay. So good evening. I take this opportunity to thank K.S.Variers Ashtanga Ayurveda for giving me this platform to actually talk a few about Ayurvedic perspective of health. This also gives me an opportunity to give a lot of more insights about the topic, again, Ayurveda, but also to know about how we can take Ayurveda in our daily life, how we can use those principles in making sure that we are headed towards good health. So I take this opportunity to start my talk, and I would also I'll be very happy to interact and help you clear your doubts. I would want to share my screen. Yeah. Now, coming to Ayurveda, as all of you know, Ayurveda is an ancient science. It is well-documented science. It has documented in such an extent that you know that it is even true to this time as well. If you would actually you notice that because of the emerging conditions or emerging pandemic which we have gone through, Ayurveda again proves that it has been giving its outcome in helping us treat any sort of diseases. So right now we would know that even in this present pandemic condition also, we are able to, so many of us doctors, I think the present earlier speakers also have explained about how Ayurveda is able to treat a lot of conditions. So here, when we come to talk about aim of Ayurveda. What is aim of Ayurveda? Ayurveda has two main aims. What is it? It is one, you're actually helping a healthy individual to be healthy, right? You're actually swasthya rakshana. Whoever is healthy, we are actually making them sustain their healthy life or their healthy body, right? And another one is what? Aturasya vikara prashanna. Treating the disease of a diseased person. So here we discuss about the aim of Ayurveda and also about how Ayurveda is so important in the present world. Next, coming to health. Now, what are the criteria of health? How will you take health and how will you know a person is healthy? Is it just by his blood reports? Is it just because if he doesn't have any conditions, any trouble, anything which is causing him trouble, will you call that person healthy? What are the criteria? Or why do we need health? So now these are the two topics here. So 2 pointers, I would say. What are the criteria for health and why do we need health? Why do we need health? We need health, again, very well said in Ayurveda. Dharma, artha, kama, mokshana, arogyam, moolam uttama. So why do we need health? We need health to attain these things, right? So one, to do our karmas, whatever, our duties, our dharmas. And then it is about to do our artha. Artha, it can be in a very broad way. It can be because our artha as our respect what we want to achieve in our life, or it might be the wealth which we want to achieve in our life, or what else? It's moksha, salvation. It's again karma. What is karma here? It is not only the lust, it's the desire. What we long to do, we want to do. It's like our what do you say? Our motto, what we want to achieve in life. For all of this, what do we need? We need health. So health, why should we concentrate on health? And why should we know, why should we actually invest on that? We need to do all this because we need to achieve so many things. if we do not have it, I think each aspect of what we want to achieve, each aspect of our life, we will be, I would say, a failure because we are not able to achieve. Now, what are the criteria of health? How do you say this is good health, right? So then again, there's a very nice definition by Sushruta Samhita, which is said, Sama dosha, sama agnishcha, sama dhatu malakriya, prasanna atmendriya mana, swasthya vidya. So what is it? It is, they are telling about sama dosha. As you know, Ayurveda, there should be an equilibrium in the doshas in your system. And when you talk about Agni, Agni is a broad aspect, but here Agni is Sama Agni, where you need to have a proper digestive capacity, or the nutrition. Where do we get? We get when we eat something and which is very good for for our health, we absorb. So for that, what we need? We need a good Agni, Sama Agni, Sama Dhatu. Sama Dhatu is our Sapta Dhatu, which I may not go in detail. Again, Mala Kriya, there is a proper excretion of the Mala, or the Mala is any toxic material which has been excreted on. Prasanna Atmendriya, that is what? You need to have a pleasantness of your Atma Indriya, the soul, the Indriyas, the sense organs, and your Mana. That is the definition of health mentioned in Ayurveda. So this also resonates with the definition which is mentioned according to the WHO. So where they say health is not mere absence of disease condition, but about the well-being of what? Your body, that is your physical health, your mental health, your spiritual and social health. So even though this definition is so way years old, but then it still holds good in the present era. Next. Because of you would see that more and more people would have been able to prevent these pandemic attacks by how? One, by their immunity being good. Two, by their health being good. So when we're talking about this, there are 3 pillars which is explained in Ayurveda for health. What are those 3 pillars? Trayopastamba, that is upastamba, that is the pillars. Those are Ahara, Nidra, Brahmacharya. Now, Ahara, Nidra, Brahmacharya, they even tell us similarly that when a house is built on a pillar, right? When house is built on a pillar, and if the pillars are strong, the house, the foundation is strong. Similarly, if your Ahara, Nidra, Brahmacharya, these 3 pillars of health, they are for the health. If these 3 pillars are protected, then we can prevent a lot of our health issues. So we need to work on Ahara, Nidra, Brahmacharya. We will discuss each one of this in detail. Now coming to Ahara. Now Ahara is a broad heading under which you can talk about what is to be eaten, when certain foods to be eaten, how certain foods need to be, and where are you supposed to sit and eat. Now you could see people standing on the road and eating. People are, the food is cooked on the roadside and people are eating it. And then what is the outcome? They are either having food poisoning or any gastroenteritis or loose motions. Yes, they suffer with so many of this. In order to prevent all this, Shastra tells about each and every detail about Ahara, like from which season to procure things, where to procure things, and how do you cook certain things, how do you eat certain things, at what time, and where do you eat. So this is how it is. They even explain about when you actually divide your stomach in 4 quadrants. Like say, there are 2 quadrants, that is half of your stomach you actually fill with solid foods, and other half you're filling with liquid foods. What about the other half? The Shastra says, Ayurveda says, you leave it empty. That is when that explains that when you're able to have another extra serving of food, it says stop. That extra space is needed. Why? So that there is a proper mixing of food. Why proper mixing of food? Mixing of food properly so that it moves into the next system, next digestive tract, so that it is well assimilated well absorbed. So for all this, when you have that extra serving, which you're not supposed to have, what happens? What happens? You start feeling this. I think I'm sure everybody would have experienced. They feel full, they feel heavy, they feel, even some people have pricking pain in their stomach. So this is the amount of detail Shastra has explained about how do you actually take food. It tells about what to be filled, how much to be filled, and how to eat, right? Now coming to what do you eat? What do you eat? How do you know what you eat, right? So then again, here they explain about so many factors which actually can be understood. Say, there are certain food which are actually easy to digest, right? Like what? They are called lagu. Lagu means which is very easy to digest. Like what? What are easy to digest? We mentioned about moong. I think most of the moong is green gram. So it's very easy to digest. So this concept of kanji coming in, especially when you do any Ayurvedic treatment, there's a concept of ganji, that is kanji. They make the rice, red rice. Red rice is easy to digest. So Raktashali, that is called Raktashali, easy to digest. With again moong. Moong is green gram. So I'm saying you, those are easy to digest. Now, what is heavy to digest? What is very heavy for your system? And when should you take it? That is also important, right? When should you take light food? When should you take heavy food, right? When you take heavy food such as what? Shira. Milk is actually heavy to digest, which is anything which is oily, snigdha, is heavy to digest. Now, when do you take this? Which again, this again varies about the doshic level in your system, one. Another thing, which season are you taking? Like say in case of winter, wherein your Hematarutu, wherein what happens? Your digestive capacity is actually good. You actually feel more hungry. The Agni is very good. Agni here, concept of Agni is the digestive fire. You're able to digest better. You're able to digest better. So there is, Shastra says, you can take anything which is oily, anything which is stikda, which is, I wouldn't say deep fried, but again, you would say in that same Ritu, there are payasams is made. Payasam is any kind of a sweet dish with a lot of jaggery and ghee. It's a little heavy to digest, but you can take it that particular season. Why? Because it's good for your stomach. You know that time your Agni is good. Now again I would there's another question. How do you know your Agni is good? I'm telling you can take it this time, but how do you know your Agni is good? How do you know your digestive capacity is good enough? How do you know? Again, for understanding how your digestion is good, you need to know yourself. You need to know when you feel hungry. What is the time you're feeling hungry? Is this whatever you have eaten in the morning, say or the previous day, you feel it is getting digested? That is another lakshana known as jirna. That is, if your digestion is well in process, you're feeling that udgara shuddhi. That is, what is udgara shuddhi? When you have a clear bowel, when you are feeling that you're feeling emptiness of the stomach. Again, you need to understand what do you mean by hunger, real hunger, and what is that when you feel your stomach is empty. Now, how do you know that? To able to appreciate the difference of these two, that when is your stomach empty and when you're feeling hungry. When your stomach is empty, and if you're asking the person, what do you want to eat? They would say anything is fine because they're just feeling empty. But when you have that hunger, then you would say very specifically, I would want to eat this taste or this dish. That shows there is a perception of taste. There is ruchi. There is desire for food. That tells about there is a differentiation about the hunger, the real hunger and feeling of emptiness. So again, going back to what we eat, right? So again, it appears that what you eat matters about, one, your digestive capacity. Two, it also depends on your season, which season you are in, Another thing is about your vyadhi avastha, right? Vyadhi avastha. Now coming to vyadhi avastha, that is also time you would consider that in while having food. What is that? What is Vyadhi Avastha? Say in simple thing, when somebody is suffering with fever, they are having fever, right? What generally people out fever feel? I'm not feeling hungry. Just give me some water or just lukewarm water or something very easy to digest. Now, why is that? Because here your digestive capacity is actually dropped down. When your digestive capacity is dropped down, and when you're able to give something lighter to digest, like discussed earlier, you are actually treating the problem. You're actually treating the problem, plus you're not hindering your digestion. So this is how we understand about what can be eaten. Now coming to when to eat. I just discussed earlier when to eat. How do you know what to eat? We have discussed. Again, what to eat, you'll have to also think about the season. Seasonal fruits, see what is available in that season. Than procuring something from outside. It's about what you're able to get in and around your vicinity, which helps for your digestion. Like in India, we don't have any olive trees, right? We don't have any olive trees. We have more of coconut trees. We are used to having coconut oil in our cooking or the groundnut oil in our cooking. That is where we are from. Now, when we start bringing olive oil or things which are not grown here, like the dragon fruit and things, right now, yes, but otherwise it's not our locally grown one. What is our locally grown? Mangoes, jackfruit. These are things are locally grown, and we are used to, our body is used to having that from childhood. So when you're able to have what we get near in and around our place and according to the season, that is way more easier for you to digest. Now coming to when to eat. Now, when to eat, again, is it only the timing? Is it only to do with the timing of food? Is it only to do the timing of food? No. It's to do with a lot of other things, like we discussed. The digestion. Is your capacity to digestion? Ask yourself, I ate a heavy meal last night. Today, am I feeling hungry? Am I feeling like eating? Am I feeling that real hunger? Whether I should be eating something or I should just let it be. Here, you can talk about the intermittent fasting that is quite happening, I would say, right now, is that everybody is on intermittent, which is good. Which is good. Why? Because, again, the concept of langana is told in Ayurveda. Langana means what? Lagu bhojana. You actually let your body stay without food for a X number of time. The X is here again considered according to your Agni. If you're feeling hungry, that means your food, the previous night's food, is actually digested, and you were willing, your digestive juices are ready for the next serving of food. So you should understand that this digestion, that is that the fasting, the langana, if you're taking also, though they say about the ratio about 8:16. I would say again, I think we should just make it very, what do you say, standardized? Or no, I wouldn't say we should make it standardized. We should make it more personalized for each person. Like for me, maybe it takes, say, 12 hours to digest something, or maybe 2 hours to digest something. So accept it, that it takes for you, if you are having a heavy meal, it takes 2 hours for you to get the food digested. And then you're actually feeling hungry and you eat. So this when to eat is not always about the time per se of the clock. It is also to do with your digestion capacity. So you need to know when you have to eat, what time is according to when you're feeling hungry. How do you know if you're feeling hungry? You feel lightness of the body. You're feeling there is that craving for certain food. You feel like eating. When you taste it, there is some when you taste the food, there is a proper taste perception that you're having, right? So these are the things when you look at timing, it's not only about the breakfast, lunch, and dinner. It's way beyond about knowing itself and knowing when you're actually feeling hungry. Now how to eat? I mean, we just eat, right? How do we? Is there any special concept in how to eat, right? So this how to eat is Ayurveda says about how do you actually eat when you sit down. You sit down in a very peaceful environment and make sure that the dining area basically is clean, neat, hygienic. Here the concept comes about mindful eating. You have to know what is going in, right? You can't just keep eating whatever is in. People just stand and eat, or they just get wherever there is space and they just eat. So you don't even know what you're eating. You don't know what is the quantity of food which is going in. You don't know what is the what do you say? What is the taste of the food? So there are people who all of us, I'm sure, would do it. We eat very fast. One, we eat very fast. We are in a hurry. While we are eating, we talk. We keep talking, or there is some meeting we are attending while we are eating, or we are laughing a lot. We are discussing over things. So what happens? There is no mindful. Anya manaso. That is, your manas is actually getting diverted. When your manas get diverted, what happens? You're not concentrating on what you're eating, and you don't even know how much is going in. Now, this can be a cause of, this is also named as stressful eating. People just keep eating. But this is already told in Ayurveda that you have to be very calm, composed, and you have to know what is going in. It can't be just randomly something going in. I always tell my patients, just look at your plate. What is in your plate? Just for a second, look, what all have you covered? Is everything going in? Is a vegetable going in? Is everything there? So this is how you say about mindful eating. You can't just randomly sit and eat. So this is what we explain about how to eat. Now, coming to very important. Now, food is really important. What about water? What about, so there's this concept of anupanam. Anupanam is anything after drink, anything that you drink, right? So when and how to consume what? It's not only water, it's anything to do with drinking. So here, anupanam, what is the best anupanam considered according to Ayurveda is jala. Jala is water. What is considered as the shreshta anupanam? But they have also explained about when to take cold water, when to take hot water. So I think post-COVID, we are all into this hot water. And I know people saying that over 2 years, they have been constantly on hot water. So again, there is a little change in it about when to take hot water, when to take cold water. So Shita Jala Sevana, it can be taken when after eating anything which is cold, anything which is causing burning sensation, which is pitta aggravating, like what? It can be your curd, wheat, these kind of things when you have, then Shita Jala is taken into consideration. So when to have Ushna Jala? Ushna Jala is always good because Ushna Jala will help you in your digestion. One, so you can take Ushna Jala when you're in having anything which is heavy to digest, and also Ushna Jala is recommended in Hemanta Rutu. So again, there is a correlation of which kind of Jala, that is Shita Jala, you can take it in Grishma Rutu, and Ushna Jala, you can take it in Hemanta Rutu. According to Rutu, is Hemanta Rutu winter. So that's how they have explained about Ushna Jala. Again, they are telling about Shira, milk. Now, when will milk be advised as Anupana? You see, any form of physical exertion, after any form of physical exertion, like either you're talking for a long time or you're walking for a long time, if there is excess of Vyayama, it's also, Vyayama is exercise. If you're doing a lot of exercise, post that, you're advised to consume milk. Also for Bala, that is for children, Vriddha, for aged people, and for people who are feeling tired. For all this, they are advised Shira, that is milk, as an Anupana. Again, Mamsarasa, that is this, I would say the soup, right? Meat soup. Now, when is meat soup advised as? Anupana. That is, they have advised that in case of people who are very shoshna, very weak, they feel very fatigued, then Mamsarasa. They've also explained about Madhya as Anupana. Madhya is Anupana, that is after drink, is Madhya is alcoholic preparations, when you consume something heavy. So here heavy will be Mamsa. Mamsa specifically for meat, anything meats that is anything heavy, Mamsa when you're taking internally, you can take Madhya as Anupana. So what are the benefits of taking water, right? What are the benefits? It feels, you get that content feel, tarpana, prinana, you feel content. It also helps in your digestion. Now, how is that? Shastra says that if you are obese, when should you consume water? You should consume water at least half an hour before food. And if you are krisha, that is, if you're very emaciated, then you have to drink water after your meal. Then what about the swasthya? People who are healthy, the consumption of water should be in between meals. You have to consume water in between meals. So this helps proper digestion of food, right? So you can see nowadays there is this growing trend of parents actually feeding their child, making them all chubby and everything, so that they are chubby. So they're constantly fed. So you should understand, not only food, water also plays a role in your health. So here they actually keep feeding. So what happens? The child, even in the earlier days itself, they are not able to appreciate food. They don't know what hunger is. They are just eating because they're just fed. So this leads to what? This you would see that over a lot of surveys are there which says that we can see a lot of juvenile diabetes, children, small children who are obese. So, so the whole idea about health is not about food alone. It's about water also. How you actually mix the both and give. Again, when we talk about the lifestyle also, you would know that it's not only the food, it's also your eating habits, the way you eat. It's not only about consuming food. It's about your eating habits. What time do you eat? How you eat? And when you eat. Next, coming to the very important and very much discussed topic is Nidra. What is it? Sleep. People do come to our OPD telling that they lack sleep. Some people opt not to sleep. Now, why do you need sleep? Why sleep is important? Now, there are people who say that I sleep for 3 hours and it's good for me. I'm fine with it. I agree with it. But is sleep actually affecting you in other ways? Why do we need to sleep? And when your body feels like it has to get that rest? See, sleep is when you are actually feeling tired, not only mentally, but also physically. How do you know? You can see that your sense organ, that they say the indriyanam swakarma, they're not able to appreciate, or the indriyas, that is the sense organs are not able to pursue. They're not able to receive any signals. They're literally like how your eye starts to shut down. So your eye starts to close down, you're fatigued, you're not able to focus anymore. You know that your sleep is slowly, your body is asking for sleep. We try to neglect that. How do we try to neglect that? We either have a cup of coffee, caffeine, something. We just pump it up so that we need to work. Now, if you keep doing that over time, what happens? We know people who are working in different time zones. People living in India are working in US time zones. So if you have to actually be sleeping when the sun is setting, or the night time, or the what we do, we are actually awake at that time. So all this over time, you'll have an impact over it. Now, what is the impact? What do you gain if you're sleeping? See, there is beautifully explained that if there is good sleep, you're able to function in different levels. One, you're mentally more aware, more focused. Your energy wise, you're more energetic. You're able to do a lot of work, and your body wise, you feel that I explained. So you feel more of happiness. So So this, what do we gain from sleep? It is very beautifully explained about Nidrayuktam Sukham Dukkham Pushti Karshya Balabalam Balabalam Vrishata Klipata Jnanam Ajnanam Jivitam Nurture. So they are explaining about two things. About Nidra, there is Sukha and Dukkha. So if there is good amount of sleep, there is Sukha, you're feeling more happy, energetic, and there is Pushti, there is nourishment. Then there is Bala, there is strength, and there is Vrishata, there is virility, there is Jnana, there is good knowledge which you get. So that's simple things which we do at our daily life. That is sleep. You sleep on a proper time. You gain a lot. I wouldn't say that you should say that you have to sleep X number of hours, then you'll feel better. No, you judge yourself. You judge your own body. How much do you require? How much do you want? Because Shastra says in certain rutus, like in case of Grishma Rutu, that is in summer, we do advise that you have to sleep during the daytime because you feel tired. And also for certain people, we say to sleep in the daytime, take that power nap, little power nap. When is that? For people who are Vriddha, Bala. Vriddha is aged, Bala is children, and who are very debilitated, very, very tired, and who are suffering from any kind of roga. So those we actually advise that you have a good sleep in the afternoon. But not for everybody. We say only night sleep is what recommended. Diva Swapna, that is day sleep, is something which we ask you to avoid. Now, what is coming to Brahmacharya? Brahmacharya here is about a lot of things. It's about the lifestyle. It's about it's about when you get up in the morning to throughout the day, whatever you do as an activity, it covers a lot of things. So here, Brahmacharya will discuss about, just in brief, about Dinacharya, Rutucharya, and Sadhvrita. Now, Dinacharya, like it's quite a lot discussed. Dinacharya is about the time you wake up, to cleaning yourself, to having baths, to doing a little bit of exercise, to do an oil massage. All of that is covered in Dinacharya. It's about celebrating your each day in a way that you're actually doing it like a routine, but each and every aspect of that has its own importance and how it impacts your health. Next, coming to, this is a brief about how each time during the day, why do we ask you to have food at noon, at 12? After 12, please have your lunch. That is the Pitta Kala. Pitta Kala is when you actually feel hunger. You feel that when you eat food, there is a good, your food is well digested, and the nourishment is there. It's not that only you have to have at noon, but why is that that time of the day is important, right? And why we should be waking up in the morning, why at that particular time you have to wake up. So this is explained, and why we have to go to bed at, say that Kapha Kala. Kapha Kala, when you're actually feeling that, we say the Tamoguna is more in your system, and you feel like shutting down and going to bed. Again, coming to the Rutucharya. Each Rutu has its own significance. Like you would say in summer, now you would say, in summer, there are certain things they have told, like about you tend to feel more thirsty than you're feeling hungry. So you tend to have a lot of liquids. And say in winter, you're feeling more hungry. That is Hemant Rutu. So each Rutu has its own. There is an imbalance of the imbalance of the doshas in your system. Because of that, there is a certain rituals that you have to follow so that you bring back the equilibrium. That is what is explained in Rutucharya. Now coming to mental health. What is mental health? Why is mental health needed when you're talking about health overall? Sadhvrita. In the topic of Sadhvrita, they explain about how it is important to be with people who are positive, how it is important to be with people who give you knowledge. You're able to focus more on your work. There is a motto in your life, and how again, when you're in modern aspect, when you're talking about, it is about how your mental state, like how your stress is going to affect your health. You're not able to sleep very well if you're mentally drained out. You're not able to eat well when you're mentally drained out. Again, you would say when you're actually very anxious, what happens to your stomach? You start feeling butterflies in your stomach. You start feeling hungry. Why? There is a connection. There is an imbalance there also. When you're mentally stressed out, there is an imbalance in your digestive. And if there is an imbalance in your digestive system, then what happens? There is no assimilation, no absorption, and then what happens? There is no nourishment. What you might. Next, what can be done? I mean, I've been telling you about what Ayurveda says and what can actually be done at today's time. What can we do? Simple. Let's just tweak it a little bit of what we can do in our present lifestyle. Make sure that we don't skip our breakfast. At least we make sure we eat that meal. We make sure we assess our digestion. We're able to understand whether we are hungry or not. Is our previous digested food it's completely gone? You're feeling that hunger or not? What can we do about sleep? Make sure that you follow a sleep routine, that you sleep at a particular time and then you wake up at a particular time. If that is followed or not. Then about your lifestyle, what are you able to do? Are you able to spend a little more time with your family, which gives you happiness? Are you able to do a little more, little more, something which can de-stress you, something which is your passion to do, so that you're able to balance there's a work, work and your personal life, there is a balance which you can bring. Now, how do we make health our first priority? Health should be our first priority. And that starts from the very own, from the time we wake up. It will be from the time we wake up to we sleep, to what goes into our system, to what we eat. We mindfully sit down and eat. So what can be done? It's just something for you to think so that you're able to do it. And I think, like I said, this is a small investment which you'll be doing for your health, long-term health. Thank you. I would be happy to take any questions if any.
Doctor, shall I read out the questions that are there in the chat box? Thank you, Doctor, for that wonderful presentation. So the first question that we have here is, can Ayurveda cure knee joint replacement syndrome? What is the duration and cost? Is outpatient treatment possible?
Okay, this is not from my subject, but I will definitely answer that.
Doctor, you can close the presentation right now so that we'll be able to see you better.
Yeah.
Yes.
Yeah. So what I was saying, this is not related to the topic I spoke just now, but I would definitely answer that question. Knee replacement, yes, we can to some extent, but then you'll have to know how much is the extent of the joint issue, because if you're talking about knee replacement, then the knees are actually, diffused. That means they are fused, or fused, right? So if it is like that, then it'll be difficult. But you'll need to know how much can we do looking at each case, because it varies from case to case. And if you're asking about what is the duration, again, if the patient is obese, if that is the reason why there is a knee issue, or is it because of any kind of physical injury because of which the knee is that condition. So we'll have to look at that. And what is the age of the patient? All these factors will come under consideration when you have to actually say about the duration and the prognosis of the condition. So these two we'll have to look into it. I can't say yes completely or no completely, but yes, definitely we can, but it will vary from case to case.
Sudarshanam sir, for your information, the doctor has to see the patient before she can comment on what the condition is. So only after seeing the patient will we be able to assess what condition the patient is in. So this is, I think, the crux of the answer to you. your question.
Okay, thank you.
The second, yeah, thank you,
Do
sir.
you have any case studies? Something to say? I am a 77-year-old man. You must have treated quite a number of patients over the years, about 90 years old hospital. So keeping that in mind, what will be the ballpark response for a man 77 years? The cartilage is totally damaged. And what type of food you may recommend? Through eating habits, can it be minimized? Suffering can be minimized.
Suffering can be minimized for the knee you're talking about, right?
Yes,
Exactly,
yes.
exactly.
Okay.
The pain can be minimized.
Okay. So definitely your one, we'll have to see if there is severe pain. That is when you touch that area itself, you're having pain or tenderness, that you'll have to see. Second, you'll have to see if there is a evident swelling around the joint. You'll have to see if there is a severe stiffness. That is, as soon as you move the joint, you feel extreme pain, if that is there or not. Then, because about you said about your age, being 77, yes, it will take a little more time for it to. Even I wouldn't say we reverse the condition, but definitely we will be trying to make sure that your routine, you're able to do your daily routine with less or minimal amount of pain. Diet-wise, one simple thing which I would recommend is ghee. Please start taking ghee. Include ghee in your diet. Say I promote that a lot because simple desi ghee, cow's ghee. It helps your brain. It helps your eye. It is good for your skin. It's good for your joints. It's good for your stomach. So that simple thing which you start doing daily, like in case of having when you're having hot rice or sambar, put a little ghee in it and have it hot, and make sure you drink a glass of hot water, also followed by the consumption. This is something which is very simple. You can include in your diet because that will help the cartilage, the spacing little bit, the synovial fluid there. It will help you.
Thank you so much. Thank you very much.
Thank you.
Well explained.
Thank you.
Thank you, doctor. So shall we go into the next question?
Yes.
Girish, are you taking over?
Yeah, can you hear me now?
Yes.
Yes.
No, there was some technical issue again, so that is why I had to go out and come in. So the next question is, how do I find my predominant dosha?
Okay. So again, dosha is prakriti, right? There are, again, you should understand there are two kind of things. There is prakriti and there is vikriti. Prakriti is what we prakrita. We have it in our, from the time we are born. There is always one dosha which is predominant. But then usually patient comes to us and asks us, doctor, which prakriti am I in right now? So I said, I cannot assess you right now because right now you have a problem. You're having a disease condition. So there will be a vikrita avastha. You're not in a proper, what do you say? You're not your own self, right? There is an imbalance. So if you want to assess your predominant dosha, I would recommend you go to any nearest Ayurvedic doctor. They will have a set of questionnaires. We need to start with, with your texture of your hair, to your skin, your eyes, to your nature. There's so much of analysis which we do to then tell you that you're, say, Vata Prakriti, or this is the dosha which is predominant in it. So what is the gist of it is, you'll have to go to a nearest Ayurvedic doctor, and he'll have to do a detailed assessment of your head to toe with your mental assessment as well, and then tell you what your dosha prakriti is.
Thank you, doctor. The next question here is, milk you said is heavy. You also mentioned that milk can be given to children and the old people. Digestive capacity of children and the old may be weaker than the normal healthy person. How do we understand when milk can be given to children or the old?
Okay. Now, here when we are talking about Chira, you need to understand what is why are we giving milk to children? We're giving milk to children so that there is a little pushtikara, that is, there is some nourishment happening. They're getting some strength, right? Similarly, same concept is there when you're talking about vriddha, aged people. They also need to have a little bit of energy, or what do you say? I would say a little bit of nourishment you would want to give. So you would give Shira. Now, how much of it you give is the key there. Now, do you give 1 glass of milk or 2 glasses of milk? Then that becomes heavy. So you need to make sure that when you give the milk, you should assess whether they are able to digest it. Most of the time, children are always at that early age, they will have a lot of predominance of kapha in their system. So what happens, there'll be running nose, there'll be nasal discharge, and they'll have cough and cold and everything. Then I wouldn't recommend milk to be given then. But once you're out of that, in the sense the child is quite healthy, there is no other respiratory or cough or cold, they're very well active, then you can give milk. Now, how much you give milk, that is where you'll have to assess. You'll have to maybe start with half a glass of milk and then see if that is easily digested or not. Is it causing any gassy feeling or heaviness in your system or not? And then you take a call. Generally, for old age people, I would recommend do not give anything like a thick milk, right? You always try to dilute the milk. What is the ratio you dilute? 1:1. Half milk, half water. That is what I would recommend. Have I answered? I hope you have understood what I have told.
Yes, doctor. I think that was a very comprehensive answer. Next question is, what age defines a person as Vruddha?
Okay. Okay. You can take it above 65 or I would say, yeah. I mean, to be very frank with all of you, I would say it depends on how you feel.
Okay, the next question from the same person. Why do we say we should not skip breakfast? How about 11 a.m. meal?
Yes. If 11 a.m. meal is good for you, you're feeling hungry only by 11 a.m. and you're feeling that breakfast is sufficient for you to sustain to your next meal, and the dinner from the previous night's dinner to your 11 a.m. meal, you're actually able to function no problem without any sign of indigestion, or you have any acid triggering, like you are having any burning sensation or not. Are you having any bloating or not? You're comfortable with your 11 a.m. meal? Go ahead. I wouldn't say no. That can be considered as your breakfast.
Ayurveda also talks about not just the timing. I think it also talks about how your meal is digested, the previous meal is digested. So that is a very important aspect for your next meal to be taken when it should be taken. So only when you're hungry, I think. Just to add to what doctor had said, I just wanted to add.
Definitely. Only when you're hungry, you should be eating, or when you're actually able to pursue the taste and you're feeling the hunger, please take.
Yes, doctor. So the next question is, there is a concept called Viruddha Ahara in Ayurveda. Would you please explain about that?
Yeah, there's a concept about Viruddha Ahara. It's about mixing Viruddha Ahara, again, on different factors they have explained about mixing two foods. You'll be shocked if I tell you, Ayurveda has no concept about, I mean, it is completely, it says a no on your milkshakes, especially your fruit milkshake is a no according to Ayurveda. There is no mixing of milk and fruit. You are not mixing that. That is Viruddhahara. Viruddhahara is anything which is works like a toxic substances for your body. So anything like that is a no. So it's a way more bigger concept which explains about small minute details, like about taking curd and simple thing, curd and meat. So the biryani which we cook with the chicken biryani with the curd is again Viruddha according to Ayurveda. If I go on like this, then there'll be nothing left for all of you to eat.
But then we can still make sure that Viruddhahara is not a continuous process. Every day we take Viruddhahara. I mean, and that way, if we do that, then we might end up with diseases. But if we are careful that way, once in a while, if we are giving that cheat day, I think we should be healthy.
I think again the thing about Visha in small quantity acts like Amrita. So once in a while, yes, you can have.
It becomes Okasatmya, I think. Okay. So the next question is, can you advise treatment for pain due to ligament pull?
Okay. I think I'll have to see the patient. This one word answer is very difficult for this. We'll definitely have to see the patient in detail, and I can definitely suggest medications also and see how much of an extent of the ligament tear is there. Is in the grade 1, grade 2, or grade 3? But one thing which I can suggest right now is very simple thing: rest. If you don't give rest to the joint, whatever is a little tone also might tear furthermore.
The next question is a very interesting question. How ghee is related to obesity for a person with BMI of 26 plus?
Okay. Again, the concept of ghee, everybody has this misconception that if you take ghee, your cholesterol level is going to shoot up. You believe it? Ayurvedic physicians actually give medicated ghee for reducing cholesterol. Okay, we have certain ghees like Varanadighritam, we give to reduce the cholesterol. So now what is this is the way you take it. And ghee has a very beautiful, quality that whatever ingredient that you mix with it, it will enhance it, right? So what we do, if there is a ghee, we enhance this with the drugs, which is going to reduce the cholesterol level. Or if you want to obesity, if that is what we want to we want to reduce obesity and we want to add drugs which is going to improve the work on obesity, we will add it to the ghee and give you ghee itself. But the way you take ghee is what matters. It's not about just taking ghee, it's about taking ghee in the right quantity and followed by that what you do. If you're taking ghee and then you go sleep, you're not doing any activity, yes, for sure, it is going to settle down as fat. But if you're taking the same ghee and drinking a glass of hot water, moving around, the ghee gets channelized. It's actually what we want to achieve. Like if we want to reduce cholesterol, we are giving you ghee. If obesity is what we want to look at, then we will look at that.
Thanks.
Thank you, doctor. So there is one statement here: age is just a number.
Definitely.
So we agree. We agree.
We agree.
So I would like to add up here that the feedback link is put forth in the chat box. Kindly all of you fill up the feedback link. Certificates for the webinar would be given after the feedback is completed. There is a comment from our MD, Mr. K.S.Varier, that session was good, well explained about the good habits to be followed. Thank you, doctor, for the invaluable time with Ashtanga.
Thank you, sir. Thank you so much.
There is another thank you, doctor, from and thanks for a great session, doctor. So I think we come to the end of the question answer session. We'll just ask once more. Anybody have any questions that you would like to ask, doctor, either as through chat box or you want to ask directly also, you can.
In fact, I would like to tell something.
Yes, sir.
A good doctor. It was a very nice session. It was you created a lot of confusion for me now, because basically, see, I'm around 62. Okay. I'm my elder brother, Dr. Narayanan, is also in the on the screen. In fact, we have a habit of having ghee in the afternoon every day while having food. You talked about ghee, that's why I'm telling. Now, recently I was diagnosed with, my test results showed that I was having some diabetes of around 180, nothing much. So he said, you better stop all these things. And also I used to have Chirabala 101 every day, around 15 drops in the morning along with tea. Now I have stopped all those things. Now I'm wondering whether you're telling here that you can have ghee every day. Now whether this is there any contradiction in this?
Again, sir, you can have the ghee. It's about what you do after that. I was speaking about an after drink.
Exercise you're talking about. Yeah.
Yes, and anupanam, after drink, that is after taking the ghee, what do you have? You have to make sure you drink a glass of hot water. So that helps the ghee to get digested, one. And what is the activity that you do? Do you actually have a hot, nice meal and then with ghee, and then after that, do you actually sleep? Then yes, your cholesterol, other things will shoot up. So it's about what you do after that and how do you take it? How much do you take it? If you're taking, say half a teaspoon of ghee every day with your rice, it's fine. Again, you should see how our traditional way of eating is. When we get our rice, then there is this dal, that's paripu they put, and they put little ghee in it. And what comes last? Rasam comes last. That's an appetizer, right? So that's how it is. So the way we traditionally eat, from the sweet to the paripu rice with ghee and rasam, and if that is the procedure, it should be done. But we do the other way around, right? What do we have? We have our ice creams and desserts in the last, which is very heavy to digest. Yeah. Our Madhura Rasa should always come first because it's heavy to digest. Yeah, so that's the beauty explained about how you should eat and when what. So it's a lot more that we can go, but each ingredient wise, I think maybe next session if they give me.
Surely. Thank you so much. Thank you for spending your time with us.
Thank you.
So I think there are no more questions, no more further questions from the audience. I would like to ask Dr. K.S.Varier, our medical superintendent and senior most part of the family, to kindly give a few words, sir.
Hello.
Hello.
Yes, sir.
Okay. Just a very nice session we have. Then what I just very recently what I have noticed, of course, we are all telling about what Ayurveda can do for this health. Past 5 years, approximately, I am saying, many old age people are approaching. That is not because of food or something, but they are mentally weak. They are isolated actually from the other people from the within the family. So they are all suffering. So what type of suggestion we can give to those people?
Okay. So again, if it's the old age, what you're looking at, and we are focusing on old age, then what simple things we would say is, I always say that, see the simple thing, like we used to go to the bank, earlier we used to do our, how do we do our banking now? We do everything is online, right? So earlier, the old means the people used to go to the bank, they used to talk to the cashier, they used to do. So the simple exercise of just going to the bank, going for a walk with your friends. If they're not even able to do that, just go to the park, just be there. So this way you're mentally, like we are talking about the Sadvrita, meeting people of your same age. Maybe they might share their own stories about what's happening in their house. It might be the same thing about telling about the grandchildren always being on the phone. It might be just a very important topic, but we'll also be making a fun, but that way they will know that we are not alone. I have people around who are also same. So that way, I think mental health, that way for them can be done. Other than any medicines, I think it's about being there for them.
We cannot say about this Jara or that type of treatment, we cannot suggest. Only mental satisfaction they need. And
yes, sir. Listen to them, sir. Listen to them. Just listen to them. They'll feel a lot better.
Just a few words only that is we can give.
Yes.
So, of course, very, very nice, doctor. Thank you.
Thank you. Bye. Thank you so much.
I would ask our executive director to give a few words.
Thank you, Girish. Dr. Gowripriya, that was an excellent session. So like we always have good sessions, this time also what happened was we had 3-4 wonderful points that I want to tell you. One was that there was a simple presentation that you did, which was understandable by everybody. And you did not care to read from the text there. You explained what was there on the slide. And that went a little more than what it required. So another thing was the language that you used was very simple, very accessible, and understandable. So these are a few points that you did. Then very, very relatable to your daily life. This was one important thing that you did in your presentation. Many presentations go overboard because they are not relatable. But what you did today was a very relatable topic, very relatably expressed. People could get what you were trying to say, and that was very important in every presentation. Thank you very much for having done a wonderful session, and we expect that we call you more on this and various other topics than what this was. Thank you very much.
Thank you so much, sir. I would say, because I have gone through your earlier sessions, and it was more about bringing awareness about Ayurveda among the common people. And I thought if I could be of help about with the same motto, right, being very simple but rendering something bigger. So that was my aim too. And thank you so much for giving me that opportunity.
Thank you, Doctor, for understanding us.
Thank you, Doctor. So I would also like to ask Dr. Vivekanand sir to give a few words.
Oh.
Thank you. Thank you for giving us this platform for Answer Healthcare. My humble respects to all the senior people there. And thank you for the good words, K.S.Varier sir. As always, you've always looked up on us in a very nice way. We hope to be able to present a lot more relatable knowledge to the common man and people of the same fraternity. We have stalwarts sitting with us, and we hope to hear them talk to, learn from them too, for the greater cause of being of use to people. And yes, these are simple, important points that if at least a few of our audience can imbibe in them or share the knowledge that they have gained from this to their family members, I think this will spread and we'll have more viewers with us, more interactive sessions, which will help us also learn better on presenting the subject better. But a great platform. I'm indebted to you for taking the initiative, and we hope to have a lot more coming forward.
Thank you. Thank you.
Thank you, sir. Thank you. So I think with that, we come to the end of this session. Thank you, Doctor, for being there, giving us your time. I would also like to thank Vigneshwaran for helping us in conducting this program without any issues and making sure that the program goes well properly. Thank you, Vignesh. So with that, we can come to the end of this session. Thank you, everybody. Thank you.
Thank you. Thank you.
We will come back to another session of our webinar series next month, last Sunday, 6:30 p.m.